Good morning. This is actually Speak On It, a part of the W.H.O current team, 8 district WHO, that WHO represent, we help out. And one of the things we are doing and been doing for going on the second year is working with the West Side Hiring Opioid Task Force to bring awareness about the opioid and other substance dependency challenges in LaShawn Ford's 8th district. Now, the truth of the matter is, some people have asked me, what is W.H.O Current? The W.H.O Current team is a intergenerational task force created in 2010 by me, Boys Edwards, Harold Davis, Brad Cummins, and others. And it consists of elders, adults, and young people. You heard us talk about WHO last week. WHO is a group of young people between the ages of 10 and 12 that works in their community distributing papers because senior citizens can't get the papers at the stores because of the lockdown. So we have these young people helping out. We see that as a very important part of getting the information out. And since it's in LaShawn Ford's targeted area in his 8th district, and the Austin voice is not only the Austin voice, it's the Lundale Garfield voice too. They actually produce 2-3 papers. And we got this youth corps, and we help out them, some grandparents on the block, and some of their parents. And it's a good experiment project because some of you all saw in the paper this week a pack of kids ages 10 through 17 is terrorizing the city of Chicago, sticking people up with guns and carjacking their vehicles. 10 years old. Last year, last program season, we did a piece where this little boy and some more little boys about that same age group was on the YouTube, Facebook, flashing a gun. They just got through shooting somebody. Now, that age group is important because somebody have to reach for them, because if they don't, they'll grow up and get turned out even deeper into this insanity. So that's what W.H.O current team WHO is. W.H.O current team represent teach. E represent educate, empower. That's what it means. Encourage. A represent advocate. I don't like being an activist. I ain't no activist. I'm an advocate. And M represent mentor. We're mentoring those kids. We're teaching them job readiness at the age of 10. Trying to keep those that got them guns in their hands at the age of 10 carjacking. But because the political administration in the city of Chicago especially, you know, they don't fund folks like us because we don't, I'm gonna leave that alone. I don't wanna get into that today. But the truth is, we do it, and I had some people call the other venue the other night of my generation, they retros, they've been out here a long time. We're talking about the NYC, NCHA developments. They used to call them projects, and there ain't too many of them left, but we was in Robert Taylor Stateway, Henry Hunter, Rockwell, all of that and more. Working with Furman House, back down on 47. We used to have hundreds of young people making a difference. But like Father Flaker said the other day, he ain't never seen it this bad in the 45 years he been here. And I tell you the reason it's so bad. It's so bad because we don't have no leadership that's connected. Overnight, this new mayor did a daily, what Daily did in McPhill in the wee hours of the morning. So after all of that confusion last week, police got her eye socket popped, the girl got her teeth knocked out, all of that happened. And this administration was talking yang in the wee hours of the night after she went over there. And those Italians gave her permission to do it. But I seen some of the Italian aldermen say, take the dang gone thing down because it's a lie. You know it's a lie. She couldn't do it on her own. And I ain't slamming her. I'm just saying this is where we are. Confusion. And when you got confusion, which is chaos, that's because you don't have consequence. How can the city be terrorized with 14 or 15 people being carjacked in the same area by 10-year-olds up to 17-year-olds? How is that possible? How could they have a funeral tonight and you have a mass shooting with the police sitting on the scene? How is that possible? How is it possible for the police to be there and don't have to work? See, no accountability. And how is it that the head of the union can call Trump and Trump is on his way? But she said, we will not tolerate whatever Trump is bringing. We will not allow. Well, how in the hell are you going to do any more than the people doing in Oregon, in Portland? Because Trump just got through tear gassing. His people just got through tear gassing the mayor out there. So all of this gangster conversation, and that's why the street level, you know, the way she stand and hold her hands, they already done claimed her. One of the gangs done claimed her. That's one of the things that's happening. They think that she theirs, but she don't even know. And the people around her, they don't know and they can't tell her. But listening to me, they think, you know, woo-woo. But I'm just saying, that's what we are here for. To bring awareness, not just about dope. That's just one of the pieces of it. We was doing this long before that. But W.H.O, the elders working with the shorties and those in between. That's how we get back to balance with discipline, accountability, structure, responsibility. So much for that. Now, would you put that picture of LaShawn Ford up there while I read this media advisory? Here's a media advisory that I want you all to listen to. You know, State Rep LaShawn Ford been doing this for a long time. I don't want you looking at me, I want you to look at him. And this is what he's saying. He's saying, Ford promotes widespread Narcan distribution. Medication reverses heroin overdoses. Chicago, State Representative LaShawn K. Ford, Democrat of Chicago, is asking the state of Illinois and other entities to ensure that every household in communities hit hard by heroin overdoses have the overdose reversal medication Narcan. The Proxone is what it really is. We call it Narcan because that's what people call it in the street. That's just one brand name of it because folks can say Narcan, they can say naproxone, you know, and so it's Narcan, it's the same thing. As opioid-related overdose and related deaths rise at alarming rates in Chicago, Black residents from Chicago's west side account for a disappropriate number of these deaths. According to June 30, 2020, Chicago Department of Health, and we talked about that last week. Matter of fact, we showed you a video. From January 1, 2020 through May 31, 2020, there have been at least 472 opioid-related overdose deaths in Chicago, which is an increase of 46% from the same period in 2019. West Side communities in Chicago still have the highest opioid overdose deaths. Of the 86 opioid-related overdose deaths in May 2020 in Chicago, 56% were Black. 22% were white, and 19% were Latinx. Most significantly, of those 86 deaths, 81% involved fentanyl, either alone or in combination with heroin. Fentanyl-contaminated cocaine is also increasingly seen as a cause of overdose and death. Now, LaShawn Ford has been pushing this hard. I salute him for that. And that's what we are doing here with this media outreach, bringing awareness. And this is awareness. You have to salute a politician that got the nerve to try to do something other than be selfish. And this man here, he be throwing down. Now, I ain't kissing his ass. I'm just calling it for what it is. Organizations, businesses, and leaders of recovery communities under the umbrella of the Westside Heroin Opioid Task Force have been working diligently to confront the challenge. Over the past year, the task force has focused on training residents on how to recognize and respond to overdose and has distributed Narcan, the opioid antidote. The truth of the matter is, despite these efforts, much more needs to be done. And it is obvious to the task force that without a huge infusion of Narcan, the problem will continue to increase. In closing, Representative Ford states, who is the convener of the Westside Heroin Opioid Task Force, he states there are over 180,000 residents in the West Side communities of Austin, East and West Garfield, and North Lawndale. That's approximately 64,000 households. Imagine how much of an impact we could have in reducing death if each household was equipped with Narcan, like we equip our homes with smoke alarms. It is time to respond with an effort to match the scale of this crisis. This is him talking. Today I am asking the state of Illinois and other entities to procure 50,000 kits of Narcan for distribution in our communities. We also are calling for additional dollars to support an increase in person skills and overdose training. For more information, you can call State Rep. LaShawn Ford at 773-416-4663. But because y'all don't like to do a whole lot of calling these days, you can also get him at Rep. Ford at LaShawnFord.com. That's Rep. Ford at LaShawnFord.com. Now, you can call it a public service announcement if you want. Or you can call it what he called it, a media advisory. It's a critical situation here. And we're going to look at some material today, and I ain't going to do a whole lot of talking because it ain't necessary. It ain't necessary to do the talking because these speeches are going to talk for you. But one of the things you're going to hear in a minute is that, but we'll talk about that when I see it come on the screen. All right, brother, let's get on with the videos. I'm tired of talking already. After reading all them words, let me listen to somebody else.
This message comes from NPR sponsor InPiction. With InPiction's indoor intelligence technology, collect, map, and analyze your company's data to better comply with social distancing policies. Adapt today. Be ready for tomorrow. More at INPIXON.com.
For millions of Americans struggling with addiction, COVID-19 has been a nightmare. It's more dangerous now to find illegal drugs and often harder to find treatment. And the scale of the disruption is massive. The UN says the pandemic has thrown illegal drug trafficking into chaos in ways not seen since World War II. NPR's addiction correspondent Brian Mann reports.
It's harvest season right now in the poppy fields of Afghanistan, the world's biggest heroin supplier. But Angela May, a researcher with the United Nations, says the pandemic has meant a shortage of field workers.
The harvest of opium in Afghanistan involves many people, more than 100,000 people. And much of this labor force comes from other countries. And, it's a kind of a labor migration in a very short period of time.
May co-authored a UN report which found border restrictions and stay-at-home orders around the world have disrupted nearly every aspect of illegal drug manufacture and distribution, from poppy harvests in Asia to meth and heroin labs in Mexico. She says small-scale disruptions in the drug trade are common, but this upheaval is something researchers and law enforcement haven't seen in decades.
Oh, yes. Oh, it's a completely different scale. Here, everything has been disrupted.
There are also shortages of chemicals needed to manufacture drugs. Utham Dhillon is acting administrator of the U.S. Drug Enforcement Administration.
The drug that we're seeing the most disrupted is methamphetamine, east and west, north and south.
Cartels in Mexico are also struggling with transportation, Dhillon says, nervous about moving drugs and drug profits.
There's just uncertainty by the drug trafficking organizations. There's a perceived increase in police presence associated with the stay-at-home orders. So you couple that with the border shutdowns, it makes it more difficult to move drugs north and money south.
According to the DEA, one drug that remains widely available in much of the U.S. is fentanyl, a synthetic opioid. That's alarming because the UN report points out during past disruptions of the drug trade, many people shifted from heroin to fentanyl, resulting in more overdoses. This kind of thing has happened before. David Courtwright, a historian who studies the illegal drug trade, says many heroin users started taking riskier drugs during World War II.
The government started buying up the opium supply even before the United States entered the war in anticipation of military medical needs. And when the war broke out, of course, smuggling routes were disrupted, shipping generally was disrupted, and so it became really hard to get a hold of drugs.
During this pandemic, drug traffickers are already adapting. The UN found more local women working in Afghanistan's poppy fields, for example, replacing workers who couldn't travel. Cartels appear to be shifting from air and land transport to shipments by sea to bring product from Mexico into the U.S. But the DEA's Utham Dhillon says he hopes some of this disruption can be sustained, a kind of silver lining after the threat of COVID-19 passes.
The challenge for DEA and all of law enforcement is to learn from what was in place at the time during the pandemic and see if we can enhance that so that in the future we can keep these drugs from coming in. So, for example, additional restrictions through the ports of entry might be something that we want to look at.
Experts say when drugs are harder to find and more expensive, more people do seek treatment. But finding help can be challenging right now, when quarantine rules have restricted access to many clinics and hospitals, often the first point of contact for those struggling with addiction. Brian Mann, NPR News.
Well, thank you.
And now, more from
Brother Amari for bringing that up. See, part of the outreach initiative from the West Side Heroin Opioid Task Force, and one of the reasons I think that State Rep. LaShawn Ford is really encouraging people in his area to get engaged is that we need information. Because without information, hope is destroyed by dope. But Narcan is an antidote that can save your life. West Side Heroin Opioid Task Force and over 100 and some other partners. They have Narcan. Now LaShawn Ford wants every household. He's talking about 50,000 kits of Narcan. And more. He wants them distributed to people's homes, like smoke alarms. Because in some communities, folks are more likely to OD than they are to have a fire. But you only know that if you from there. And I think that's part of what this initiative is about. I know that's why I'm part of the We Help Out piece. Now, Amari was sitting here, man, State Rep. Ford was here a year or so ago, and what you see there with your current team, who? State Rep. Ford asked me and Amari, say, well, can't you put Westside Hiring Opioid Task Force up there? We said, yes, sir, we can. And we did for a minute. But then people got confused. So now we put it back the way it was, with your current team, W.H.O. But for Ford, W.H.O. also means Westside Hiring Opioid Task Force. And we still help out. All right, brother, let's get something else. I don't want to go back to what I did last week. I just want to keep it moving.
I cannot express how difficult this news has been to hear.
BC's provincial health officer got emotional at her briefing in Victoria Thursday afternoon. As she updated the province on the latest information about COVID-19, Dr. Bonnie Henry also addressed a significant spike in overdose deaths in BC. 170 people died from an illicit drug overdose in May, marking the highest number ever recorded in a single month in the province.
My thoughts and condolences go out to the families and friends of those who have lost their loved ones.
The latest overdose numbers mean that more British Columbians have died of overdoses in 1 month than those who have died due to COVID-19 all year.
What we do know about these recent deaths is that there has been a dramatic increase in the toxicity of the street drug supply here in British Columbia, and it is around the province.
The Canadian Drug Policy Coalition says Canadians will continue dying if changes are not made.
Not one of those deaths have taken place in a site that is where people are supervised. So jurisdictions need to be scaling up these kinds of services. So there is just so much we could do across the board, from providing substances by providing safer spaces for people to use substances, by taking a much more robust public health approach to contacting people who are at severe risk of overdose. We're not doing enough on any one of those fronts.
According to the report, most drug overdoses are happening in Vancouver, Surrey, and Victoria. McPherson believes that the COVID-19 pandemic is also to blame.
The minute the U.S.-Canada border was closed, we got anecdotal reports that the drug supply is changing. And sure enough, if you look at the coroner's report from BC, more extreme levels of fentanyl are being found in people's bodies.
In March, the provincial government announced a plan to offer a safe supply of prescription drugs to substance users during the COVID-19 pandemic. Dr. Bonnie Henry acknowledged the pandemic has taken a toll on drug users.
COVID-19 is forcing all of us to stay farther apart from others. And this can be very isolating for some people, and it makes it more able for them to hide their drug use from others, even if they might otherwise have reached out for help or been very careful about not using alone. We know that using alone right now is exceedingly deadly.
In Vancouver, Miranda Fatour, City News.
You're not a dish.
Now, what happens with this, I want you to understand this. This ain't just here. This ain't just Negroes. No, it's not. That's Canada. And they saying that they having the same problem we having. And they having it with the residents of Canada. So this dope thing, it really don't care, about your complexion. Because you get hold to it, you will become addicted. And that's why you need Narcan. Something that can help resurrect you if you slip. And people need to be trained. The training ain't complicated. And the particular substance, the medication, it don't affect nothing else. All it does is reverse the overdose. Hell of a thing. You dead. They pop you in the hip, in the arm, you back here. You gotta know this here. That's why, you have to salute Sean Ford. He telling the governor, man, we need some money. We started off talking about just the dope epidemic. And then this doggone pandemic hit. So, yeah, of course, I do this. I'm going to talk about both of them. We got a gang violence pandemic, like I said earlier. Father Flager, and I'm referring to Father Flager because he done put the work in. He been out there. He there now. And he got up a $15,000 award That's $1,000 for everybody that got shot the other day at the funeral. And since I'm on that, that's a pandemic too, but it's been popping for a long time. But I have to agree with Father Flake. I ain't seen it this bad, never. And I've been out here over 50 years. That's right, over 50 years. On these streets, over 50 years. And I got credit on these streets. I ain't seen it like this. But the thing that's really different is that people now are like ostrich. Those in those positions, they put their head in the sand and can't nobody tell them nothing. They got their little booty tooted to the air. So you trying to tell them something in their ear is in the ground, but their butt is the only hole they can hear through. So the whole city is stinking with these so-called elite types that think they know everything. And all you're doing is contributing to a problem that don't have to be. This problem can be addressed. Yes, it can. And Obama sent Holder here in 2010. And Holder bought and got that $90 million hit. And they came over to Culture Calm. Well, I already know. Can TV know. We was down here. And that's why Retro Current Team was developed. Because everybody had their own organization. Harold Davis had his organization. Boys had his organization. Cummins had his organization. We had his papers. Everybody. But we came together as a team, as a task force. And we still here. And things was making progress in the Cultural Calm Community Watch. And then the administration changed. That administration didn't seem to know that community policing existed. And the next thing you know, the police stopped working. And the next thing you know, things just began to unravel. And that's a sadness. And it don't have to be like that. And I had great hopes for this colored man. But it ain't for me to judge. But I think she might need to talk to some people other than the people she's talking to. But I told some folks the other day in another venue, I leave you where I found you. I had them signs from that mayoral election. I went to the basement this morning. I took them signs and put them in the garbage. I was holding on to them because I said, well, this is going to be some history. The only history is going to be now is that things are worse than they ever been. Got to stop being so combative. Stop being so arrogant. Stop trying to be big mama. We ain't going to tolerate Trump. We ain't going to allow Trump. Trump said, I'm coming. So now you say, oh, he going to do what he been doing, just give us support on the dope tip, da-da-da-da. Trump need to come here. He don't need to do what he doing in Portland. And I don't know what he did in Kansas City, Missouri. But Trump do need to send some people into these neighborhoods. And maybe they should sit at some of these funerals. Maybe they would be able to do their job. Because if you had the police at the spot and the dudes still came through and did the shooting, and the folks at the joint had their own artillery, the police should have knew it was coming. They should have been able to feel, detect a threat. Dudes get away from shooting folks. They got one person in custody, and I bet he was at the funeral. And that's commentary. And I got to tell you this because I got a call yesterday from somebody that knew the person who funeral it was. I ain't going to say too much because I ain't going to get off into this here. But now, that's what I don't understand about Facebook. We try to get them to, boost the post with any of these type things here. They make it clear to me, man, this ain't what we do. We don't educate people. We don't do what you do here. I can't even pay them to run this here type of stuff. They don't want you educated. But now, this dude being shot in the face and in his chest, and dude standing over him. It was all live on Facebook. Can you imagine? They good at showing you the devilment. But when you're trying to save lives, man, I don't understand. And, that's their thing. They do what they want to do. So, I ain't going to be trying to, get them to boost nothing. But if they allow us to put it on there and they show it, that's cool. If they don't, well, we'll go to YouTube as long as they do. And all that negativity, all that profanity, all that old guns and stuff. Then you wonder why these kids like that. They like that because people like me, we can't get the word out. Because the media agenda is to portray and enable the violence. That's what's up. And the commentary is real. Because this ain't just about one thing, it's a lot of things. Pandemic, epidemic, no hope, more dope. Trump told you people are going to be committing suicide like crazy, getting drunk as hell, overdosing. He told you that. But in Illinois, during the month of April, when it was kicking, they sold over $37 million worth of reefer. Reefer was essential. Alcohol sales went up 55%. They said that was essential. But folks couldn't get to church. And I guess not. They got up in there and the Holy Ghost got hold to them and they took their mask off and they was dying like flies. Them, the preachers, the bishops, everybody. So we got issues here. And I'm grateful to CAN TV and I'm truly saluting Omari because he be looking out because, he know I'm retro. And sometimes retro means a little bit slow on that. But he be trying to make it happen. He be trying to say, whoa, here and there. And I appreciate that. All right, brother, let's see this new thing they talking about here.
Milwaukee County is logging never-before-seen numbers in drug overdose deaths. Officials say the county is on track to shatter last year's already record high number of lives lost. It was 418. Medical experts say, yes, the current pandemic is playing a role in this. Angelica Sanchez has more on the call to replace the stigma with hope.
There's no shame in seeking treatment. There's only a downside in not seeking treatment.
Prior to the COVID-19 pandemic, there was another crisis healthcare professionals were dealing with, the opioid epidemic. Dr. Michael Genovese with Acadia Healthcare says it's still plaguing communities.
This has been a silent epidemic going on for quite some time.
Numbers show in 2019, the Milwaukee County Medical Examiner's Office saw 418 lives lost to drug overdoses, a record high for the area. They predict this year, 640 lives will be lost to drug overdoses.
That's 640 families that can't get their family member back.
Dr. Genovese says the pandemic is playing a role.
People have been forced to quarantine in their house. They haven't been able to go to support meetings.
Sarah Schreiber with the Milwaukee County Medical Examiner's Office says the county's drug overdose deaths could soon surpass those dying from the coronavirus.
We've signed 241 cases to drug-related causes, and we've only had 360 plus related to COVID in this county.
There have been 26 probable drug overdoses so far in the month of July.
Don't forget to look for those in your circles that might need help and support during this time.
A message echoed by healthcare professionals.
What we need to do is replace stigma with hope.
Acadia Healthcare has 13 comprehensive treatment centers in the state of Wisconsin. Experts urge anyone struggling with substance abuse disorder to reach out for help. Reporting on Milwaukee's South Side, Angelica Sanchez, Fox 6 News.
The Wisconsin Addiction Recovery Helpline is also available statewide 24 hours a day, every day. Simply call 211 or more specifically, 833-944-4673. And yes, that is on our website, fox6now.com.
Now, we're gonna run through the rest of this sort of quickly because that's Milwaukee. That's right across town, right on down the highway. It's all around us. And I wanted to have a diversity, a diverse showing. Milwaukee, they got a lot of white folks there, them dairy people there. But that didn't stop them. They still got the problem too. Canada, we just saw that. LaShawn Ford 8th District, we saw it last week. We saw some other spots. But anyhow, this piece here is interesting. And it's a short piece, but what's so interesting for me is that the federal government has spent billions trying to deal with this opioid situation. But now they saying, don't give up hope, man. We got a worse situation now. They talking about 2019 than we had in 2018. And it ain't looking too good. So let's just look at what's developing now, brother.
Seen a spike in overdoses just this past week. According to health officials, at least 13 people have died in the past week alone. And WCPO 9 News reporter Jasmine Miner is live now to explain why officials say this spike has a direct ties to COVID-19. Jasmine, very alarming numbers here.
Yeah, it's extremely alarming. And when we talk to Newtown Police Chief Tom Synan, he says the most difficult part about this is that we have this spike in particular that's happening right in the middle of the COVID-19 pandemic, which is not helping at all. In fact, on top of the numbers that you just announced, there were 35 overdose deaths in the month of March just in Hamilton County, and that's according to health officials. Now, Chief Synan says he believes that a key role in all of this is actually the isolation that's coming from self-quarantine with coronavirus, and that's why many who are in need of help aren't dialing 911 or asking to be taken to the hospital when they do overdose. He says the isolation has also put a hold on peer-to-peer mentorship, which he went on to say one of the most vulnerable populations right now is actually inmates who have recently been released, and now it's trying to figure out how to help them during this pandemic.
Look at how many people had to be released from jail. There are several hundred who were probably a vast majority active users before they went into jail. Their tolerances will be low. So we're trying to measure all these factors and all these potential problems and say, how can we get out in front of them?
Well, the police chief also said that he wants to clarify that anyone who believes treatment is not available just because of the coronavirus, that is simply not true. If you do need help, there is help for you. In fact, if you go on my Twitter and my Facebook page at Jasmine Miner TV, I've got a list of Hamilton County numbers that you can call. And we also have a list of treatment options right now on our website at WCPO.com. I'm reporting live. Jasmine Miner, WCPO 9 News.
If my man was wearing this,
and part of what you saw with the man laying on the slab, the dude was administering some Narcan. They got the Narcan where they can inject you in your arm, and then they have the nasal spray. And the West Side Hand Opioid Task Force will train you and help you get either or, the nasal or the injection. All right, brother, let's just go to the next piece.
Good evening, and it's great to have you with us here on a very busy Tuesday night. There are fast-moving developments in the coronavirus pandemic. The U.S. approaching 3 million cases, more than any other country. Dr. Fauci saying this is still the first wave of this. And tonight, the dire steps inside hospitals in the U.S. 5 members of one family coming down with the virus, the family matriarch dying just 3 days after her diagnosis. More than 131,000 lives have now been lost, and tonight a new model from the University of Washington now projecting the death toll could rise above 200,000 by November. Tonight, Florida reporting a staggering 7,300 new cases in just the past 24 hours, 63 deaths. Some Florida hospitals now running short on ICU beds, and still authorities in that state are ordering schools to open in August. Texas reporting more than 10,000 new cases in 24 hours. The Pentagon tonight is now sending medical and support personnel to hard-hit San Antonio. Arizona, meanwhile, reporting more than 3,600 new cases, 117 deaths. You can see there people waiting in their cars for hours for tests. Tonight, the story of one man who waited 27 days for his results. Amid the spreading virus, New York now adding 3 more states to the list of 19 states. Visitors coming to New York must go into their own 14-day quarantine upon arriving here. And this evening, President Trump late today saying he will put pressure on governors to open schools across this country this fall. And this evening, news on how long those tiny virus particles could actually linger in the air. We will get to it all, and ABC's chief national correspondent Matt Gutman leads us off.
With the country closing in on 3 million COVID cases tonight, hospitalizations increasing in 28 states, some pushed to the very brink.
Our hospitals are very full, and at every hospital in the county, there's many COVID patients who are very sick.
At the Ventura County Medical Center in California, ICU patients spilling into the ER. And across the country, more than 300,000 new cases in just the past 6 days. The virus ripping through entire families like the Sanchez's of California. 5 members infected. Daughter Brenda didn't think she'd survive.
My thinking was if I end up in the
hospital, I'm gonna go too. I'm gonna die.
Brenda's mother, the family matriarch, died only 3 days after testing positive. Today, we rode along with the Phoenix Fire Department in the zip code with the most COVID cases in all of Arizona.
So we just learned that this is a possible COVID call. Everybody's got N95s on it. About 50% of all the calls that this station does are COVID calls.
Martin Molina tells paramedics he's had splitting headaches for 2 days. His girlfriend, Yesenia Lopez, comes out. She had just given birth 3 days ago.
Are you scared about what's going on inside your house?
To be honest, yes, because we're all together. Yeah, and plus my little boy. I just barely had him like Saturday.
Like so many here, 3 generations of the Lopez family living under one roof. Yesenia has had symptoms, she says. One of her children has also had a fever.
Scared, confused.
I bet you're scared.
Yeah.
I mean, it's terrifying. What are you going to do?
As the emotion wells up, she clutches that St. Jude pendant. The wristbands from the hospital still there.
I mean, my mom can help me out, but...
Martin was finally taken to the hospital.
Is this a typical call?
Yeah, this is what we see in this first due. At Maryville, there's a proud tradition of families living together, and unfortunately, that's the situation for affordability where they're all under one roof.
But reinforcements are on the way. The U.S. military sending nurses and respiratory specialists to San Antonio.
We are days away from overrunning our hospitals.
In Florida, 100 nurses headed to Miami, where ventilator use has more than doubled. 50-plus hospitals across the state at ICU capacity. At the same time, the state ordering schools to open next month for 5 days a week for all students. The president today saying he'll also push to reopen schools.
We're very much going to put pressure on governors and everybody else to open the schools.
With the virus raging, testing sites packed, supplies are depleted, and the labs are backed up. Robert Rosetko had symptoms and was tested at an urgent care in Tucson, isolating himself from his family and then waiting 27 days to learn he didn't have the virus.
That specimen was sitting in a lab in Phoenix, apparently, for maybe, 3 weeks? So is the test result even valid?
Reassuring news, but he waited 27 days, as you pointed out there, Matt. Matt Gutman with us from Phoenix tonight. I know you have more on that new forecast, that new projection, looking at the potential death toll here in the U.S. going into the fall, Matt.
Yes, David, that University of Washington poll, it's a model, predicted 208,000 deaths by November 1st. But those numbers could change if the present number of people in at-risk populations continues to surge, then more people will die. But if nearly all of the population begins to wear masks, then up to 45,000 lives could be saved.
Well, put on your mask. I got mine on. They say I could take it off in here. But when I leave out of here, I have it on. I would suggest you do the same. All right, we're going to just keep it rolling. And while he's looking for the other piece, there was a piece there with those special police that Trump got up there in Portland, snatching them women, shot dude in his face. I mean, it's ridiculous. That ain't what we want in Chicago. But we need something that will do something more than put their head in the sand and toot their booty to the face of the public and the communities. So we'll see. They say they'll be here in a minute. We'll see. Because right now, it's ridiculous. 15 people shot at a funeral. Another 14 or 15 people done got carjacked. It's ridiculous, man. Ain't no quality of life. And that's ridiculous. How do you live and you have no quality of life, but the criminals and the thugs are allowed to run rampant? And all you do is say they've been deprived, and that's why. And when the police lock them up, you let them back out. That's why those 10-year-olds out there, they know they ain't going to jail. Hell, they ain't going nowhere. Even that 17-year-old who could be treated as an adult, he ain't going to jail either. Matter of fact, I probably shouldn't say this, but, all right, brother, go ahead on. I don't want to say all that.
Deaths from drug overdoses are on the rise, jumping up almost 5% last year, reaching almost 71,000. That wiped out the slight decline in deaths in 2018. Now, experts fear that the death numbers could get worse next year. More than 35 states saw an increase in overdose deaths. Many experts have pointed at the overprescribing of painkillers as the root of the opioid crisis.
Now, that's the piece I was telling you about. It's so short. 71,000 deaths. They're talking about pandemic. Man, you covered with death. And that's the sadness, because at the end of the day, we all have to do our part. But the truth is, the resistance they're having in some areas, people not wearing masks, but now they don't even want you to come from border to border of the states because of this situation. And back in 1918, when they had the Spanish flu, and they had the hanging of Negroes and all that other stuff that's happening, the same thing here. I was looking at something the other day. Young black girl, 20-year-old, living with a white boy, called it roommate, had a little black butt up in there with him. They found her hung in the garage. They're hanging black folks like they was doing back in the day. You gotta have a pandemic back in the day. So the question becomes, what is this punishment? What is this judgment that comes up on this country and the world for every 100 years? All right, if there ain't no more roll-ins, brother, we're gonna call it a day. We're gonna let folks have it for the way it is. I'm not gonna continue